Welcome to your Moving and Handling Level 1. This podcast is in place of the e-learning module, and your training record will be updated later today, showing you've completed it. My name is Margaret Stone and I'm the Ergonomics Manager for the Trust, and I'm going to talk you through this training podcast today. The session has been written to comply with the Core Skills Training Framework, and it meets all your statutory and mandatory training requirements for manual handling theory. Moving and handling isn't just about moving people in the NHS, we move other items too. In the healthcare sector, moving and handling injuries account for 40% of work-related sickness absence. Some of these injuries will have been sustained at home as well as in the workplace. Approximately 5,000 moving and handling injuries are reported to the Health and Safety Executive from the health services each year. It costs the NHS approximately £1 billion a year to treat injuries that result from manual handling. There is a significant amount of legislation and guidance relating to moving and handling. We are, over the next few slides, going to look at the Health and Safety at Work Act 1974 and the Manual Handling Operations Regulations 1992. The aim of this legislation is to protect employers, employees and members of the public. So let's start with the employer responsibilities. Written in the first paragraph of the Manual Handling Operations Regulations, it states that we should avoid any and all handling activities where there is a risk of injury. We need to assess any handling activity that we cannot avoid and put into place methods to reduce the risk of injury to employees as far as is reasonably acceptable to do so. This may require team handling or use of equipment to reduce the risk of injury. We also need to review all risk assessments carried out on a regular basis and at least yearly. Here at NUH we have a manual handling policy that you need to read in order to fully understand your role and responsibilities within manual handling. If relevant to your job role, you may also need to read the Handling of Bariatric Heavy Patients over 25 stone 160 kilograms procedure. Both of these documents can be found on the intranet and they're updated every 3 years. Here at NUH, the ergonomics team are specialists in manual handling, and we can be contacted if you need help and advice. We are also supported by back care assessors in each working area, and they may need to carry out a competency assessment with you whilst you're doing moving and handling at work. This assessment is dependent on your job role and is to ensure you are safe when undertaking manual handling of patients, goods or loads in the workplace. This assessment is Level 2 manual handling. Risk assessments need to be carried out on all identified risks in your workplace. You can help in identifying the risks. These then need to be monitored, audited, and importantly, staff need to be made aware of them through the writing of operating procedures or safe systems of work instructions. These are put in place for your safety as a result of the assessment, so please get involved in the risk assessment process as we are looking at making the job as safe as possible for you, so please do have your say. All employees need training and guidance on the moving and handling they need to undertake in their area. This means that any specific handling of equipment or technique used in your area, you need to be trained on this locally on your ward or department by your supervisor or assessor. The Trust is required to provide specialist equipment to move and handle loads and patients in your area. Training for this is provided in your local area by your assessor or supervisor. The ergonomics team also arrange drop-in training sessions with the equipment representatives for training on patient hoists, wheelchairs, Arjo Steady and Rotunda, so look out for dates published on the ergonomics webpage. NUH also provides staff with support following musculoskeletal injury via the Staff Occupational Physiotherapy Service. Occupational Health are also available to provide any help and advice that you may need. So that was the employer's responsibilities, now come ours. As employees, we are responsible for following all safe systems or operating procedures in our workplace. These are generated following a risk assessment and are there to make us all safe. Be aware of our responsibilities in the manual handling policy and procedure at NUH. Use all equipment that has been provided to help us with our work. Not to misuse or interfere with any equipment provided for our safety. To cooperate with NUH on moving and handling matters. Tell NUH if you identify any hazardous handling activities or defective equipment, and to ensure that your activities or emissions do not put yourselves or others at risk. So, what is moving and handling? It's the transporting or supporting of any load. The load can be animate or inanimate. Moving the load by lifting it, carrying it, putting it down. Through pushing or pulling. By hand or by bodily force when using equipment. Your spine consists of the spinal cord, vertebrae, intervertebral discs, ligaments, tendons and muscles. Maintaining their good health is important and essential for moving and handling. Musculoskeletal disorders of the back and limbs can include damage to your joints, tendons, ligaments, muscles and discs. Please don't sit there and think, this will never happen to me, because injury can also be cumulative in nature, which means it builds up over time and therefore it may already be happening to you. It can also be a hernia, abrasion, fracture or simply wear and tear. But one thing they all have in common is they all cause pain. Things we can all do to help ourselves. Be aware of our posture and try to adopt a good one. So, how are you sitting now? Is your posture good? Or are you sat slouched with your legs crossed? Oh yeah, I can see you over there. Try to use a chair with a supportive backrest and make sure it fits you. Change how you sit every few minutes. And if sat at a workstation, get up and move around every hour. Stay active, do some exercise during your day. Work on strengthening abdominal and back muscles. Maintain a healthy weight, quit smoking and try to reduce your stress. We're now going to look at the ergonomic approach for risk assessment. This is all about fitting the job to the person and not the person to the job. We're going to use the acronym TILE and take a look at this over the next few slides. So now we're starting with the task. So, does this task require the person performing it to twist, stoop, bend, push, pull, or carry out any sudden movement? Looking at the individual capability, is the person carrying out the job pregnant? Have we completed their pregnancy risk assessment and looked at the moving and handling they need to do in their role? Do they now need some help or a change to how they work? Is the person disabled? Do they have a personal risk assessment looking at what they can and cannot manage to do and how we can help them? Are they suffering from a health problem? Is it a long or short-term issue that we need to make adjustments for? The load. Is it heavy? If so, how heavy? Is it difficult to grasp? So how are they going to hold it safely? Is it sharp, hot, cold? Do they need personal protective equipment or PPE, and has it been supplied to them? Is the load unstable? Could it fall and break? The working environment. Are there space constraints, uneven, slippery, unstable floors, or even different floor levels? Do staff need to move the load on stairs or in a lift? Are the working conditions hot, cold or humid? Do staff have personal protective equipment and have regular breaks planned into their working day? So, we've looked at TILE. It stands for task, individual capability, load and environment, all of which need to be taken into consideration when looking at assessment of risks. This diagram shows the advisable weights to be lifted at or through the various zones. The heaviest amount and the safest zone to use when lifting is the one close to the body at waist or elbow height. So for females the weight is 16 kilograms and for males it's 25 kilograms. Okay, so for example, a box needs to be lifted from the floor to elbow height. The load moves through the mid-lower leg, knuckle and elbow height zones. Therefore, the lowest of these weight zones is acceptable for this manual lift, and that is 7 kilograms for females and 10 kilograms for males. If this task needs to be done with the arms extended, then the weight of the load should be lowered further, as any load will feel heavier and put more strain on the body, especially the back, as it's held away from the body. So if this needs to happen, the load should weigh no more than 3 kilograms for females and 5 kilograms for males. This diagram shows the weights advisable for when we're sitting and carrying out manual handling. The zones here are for the handling between waist and shoulder height, dependent on gender. Should we need to carry out any handling from the floor, or it involves twisting, then a more detailed assessment of the task is required. Team handling usually takes place if the handler decides the load and task is beyond their capability or is likely to cause them an injury. It's important to consider, is there enough space for 2 people to carry out the manoeuvre? They both need to have safe access to the load, so can they both get close enough? One person needs to plan and take charge of the move, and they become the coordinator. They need to ensure everybody involved knows what is expected of them and when they need to move. It's important to think about the dignity and safety of everyone involved during this task. So we've looked at the amount of injuries and work-related sickness absence for health and social care staff, responsibilities of the employer and employee working in partnership for safety at NUH, risk assessments and safe systems of work or operating procedures should be in place. Do you get involved in the risk assessments in your area? If not, why not? The risks are yours after all. So get involved and help improve your safety and that of your colleagues. We've looked at good musculoskeletal health, safe moving and handling, and the ergonomic approach to risk assessment through TILE. So we've reached the end of your Level 1 Manual Handling podcast. Some of you will need to be assessed carrying out safe manual handling practices in the workplace. This is Level 2 Manual Handling. So if this is you, then please contact your back care assessor to arrange this assessment. Details of the assessors and where they work can be found on the Ergonomics webpage. If you do not need an assessment for Level 2, then your manual handling is now complete. Thank you all for listening.